there's only so much oil or alcohol you can put on your before after photos. Like, come on, you show this like picture of someone kind of way fattier than they were afterwards on table, obviously, and then they're just greased up. This is all smoke and mirrors. Patients should do their homework.
Welcome to HKB Uncut, the health, knowledge, and beauty podcast.
On this show, we unpack the newest techniques and trends in cosmetic surgery, how to tune out the social media noise to make empowered decisions about your appearance, and what you need to know before you book a procedure.
I'm Dr. Bill Kortesis.
And I'm Guarav. We are board-certified plastic surgeons and co-founders of HKB Cosmetic Surgery, an award-winning practice with 11 locations across 6 states.
In other words, when it comes to aesthetics and cosmetic surgery, we've pretty much seen it all, and we want to share our knowledge and unique approach to aesthetics and beauty with you. Whether you're interested in cosmetic surgery for yourself or want to separate fact from fiction in the plastic surgery world, we hope you'll tune in each week.
All right, Happy New Year, everybody. Guarav here.
Bill Kortesis.
And we're excited to talk to you about how we think 2026 is going to shape up from an aesthetic trends perspective. But looking back, 25 was an amazing year for so many reasons. Bill, what were some of the things that you thought were you were doing more of in 2025?
You know, there's this huge trend last year in regards to patients wanting to downsize their implants or get rid of them. So it's like, hey, I wanted the smaller trend was in. You know, everybody wanted to be small.
Yep.
And it was either removal or downsizing.
And then how about the people who were having enhancement done? Was the volume the same or was it much smaller volume?
Extremely small. When I first started practice, everybody wanted to be big. And now it's like the trend is like really small.
Like 150s.
Like really small.
But man, they look great.
Yeah, they do. And honestly, with some of the newer styles of implants that are out there, even the small implants can give you a fair amount of projection, which is great. Yeah,
and especially with some of the different approaches, like, this different approach with Preserve, you can use smaller devices and get a pretty big bang. So pretty interesting. I agree with you. Smaller enhancements, downsizing, definitely trend.
But I think 2025 was the year of the young facelift.
Oh yeah, for sure. And like, honestly, it's great because it's more people like saying, wait, maybe I shouldn't get all this filler. Maybe I shouldn't get all this neuromodulator. Maybe I just need to, bite the bullet and have a surgical intervention. And like, so definitely a lot more facelifts, a lot more, other facial procedures, a pretty steady amount of neck contouring, a lot of eyelid procedures, tons of body contouring. I mean, the year of GLP-1s, being fully mainstream and all this weight loss. What are some of the top surgical procedures you were doing to manage skin excess after massive weight loss?
Tummy tucks.
Yep.
Still number one in my practice, without a doubt, and it will continue to be this year. Looking forward.
And make sure.
I know we're just talking about 25, but 26, it's still going to be.
And make sure that when people hear the word tummy tuck, it's very generalized. And what we're talking about is, it could be anterior, which means like your front part of your torso, but it could be posterior too, and it could be the whole thing. So we did a lot. I would say we did a lot of circumferential stuff. And it's just dramatic, the results that you can get from that.
I mean, the cool thing is we can remove skin from anywhere in the body.
Yep.
Arms, legs, buttocks, upper back, you name it, we can do it. And there's places where you can hide the scars. But yeah, I agree with you.
Yep. Other trend was there was that kind of filler kind of dropped off, and now fillers are kind of coming back a little bit. So there was a period where like fillers like really had a lot of negative stuff in the on social and just in general. And I think we're finally swinging that pendulum back. And at the end of the day, like a little of something is great. Too much of any one thing probably isn't great. So we've learned that. And so fillers are a very good tool. We still use them in our patients, but we use them strategically and using a lot of biostimulators. So biostimulators were really big. Radius, Sculptra, PRF, PRP, all these other things that are kind of leading to regeneration. So I think those are pretty good recap of 25. So going into 26, what's your thoughts on what's going to happen?
I think we're going to see a bigger explosion of the GLP-1s, without a doubt. I think you're going to see I don't know what the patient population was, but somebody said it up to 25, 30% of patients were on a GLP-1. I think we're going to see it upwards, potentially 40, 50% this year.
Yeah. So what that's going to be is there's going to be more weight loss, more skin excess management. I think that there's people talk about the Ozempic this, the Ozempic that, the Ozempic this, meaning body parts. Like where you can have deflation of the face, deflation of the breast, deflation of the vulvar area, abdominal excess. And there's going to be interventions that can be done with all of them. do you think that there's going to be more preventative measures? So now we know that people are on GLP-1s. So what are we supposed to do to help them maybe minimize that change or potentially avoid a surgical intervention?
Well, I think we're learning more about the drugs itself, which I think is great. And I think part of that knowledge base is making sure that patients are still maintaining proper nutrition during the GLP-1s, which without a doubt, they need to eat a fair amount of actual proteins, and they still need to do strength training. And it's something we talk about all the time with patients because this muscle wasting thing is real.
Yeah, sarcopenia, it's a real thing.
It's super real. And so if patients are not strength training and they lose that muscle mass, it's almost impossible if you're really old to get that back.
Yeah.
So it's super important to go down that road. So how do you talk to patients about that?
Yeah, and I don't personally kind of guide them through that process of weight loss and GLP-1s, but our team does, at our locations. And I think the thing that's happening is the actual medications and how they're targeting the patients and how they're actually leading to the weight loss. Those are getting more refined to where like some of these newer ones you're getting less of that sarcopenia. But the other thing is going to be the period that weight loss happens over. Ideally, if that can be controlled and it can be over a prolonged period and you have slow and steady weight loss, that's way better than anything aggressive. The yo-yo is where like you get these issues and you get this dramatic wasting and you get dramatic laxity, you get dramatic muscle loss. So I think this is going to probably be more of this kind of microdose phenomena. Everybody's going to be microdosing and then probably remain on these super small microdose concepts. And, all these big manufacturers have reduced their pricing. So even more people are going to get on them. So you're right. It's going to be everywhere. I think that it's probably a little overprescribed. And so I think that hopefully there's going to be the pendulum shift and we'll throttle back and use it in the way that it's intended to be used. But there's so many other things we don't even know about it, like these other potential side effects and good for, your brain, or it could be good for end organs and all these things that it's hard to separate a reality from noise. And I think we need to see more peer-reviewed literature. We need to see real data. So often now in social, like so many people just will follow certain things like, well, I heard that on this, and then they think that's dogma, that's fact. But like, we just need to see the data.
But if it's real, I mean, it's a game changer, right? And folks, like the patients were end up having to do these huge bariatric procedures to do weight loss. Now all they have to do is take a shot to lose anywhere 40, 50, 60 pounds.
Yeah.
Curing their diabetes, renal disease, it's huge. But it does leave them, to your point, with issues that I think what's going to be even a bigger problem in 26.
Right.
So a follow-up to that, if GLP-1s are on the rise, what does that mean for surgical interventions?
Yeah, I think that we're going to be doing more surgical interventions, more skin removal procedures, more circumferential contouring, abdominoplasties, brachioplasties, which are arm lifts. We're going to be doing thigh lifts. We're going to be doing things like face lifts, neck lifts, eyelid lifts. And then sometimes we're going to be doing a different kind of lifts where they'll have so much laxity. We'll do something called fleur-de-lis abdominoplasties where you're removing tissue in different fashions to get people where they need to be. I think the interesting thing, too, is that people need to remember that they need to kind of maintain this. And we've seen the GLP-1 patient kind of swing also. So it's like you need to make sure that they're just going to be stable. It's just like when we talked about liposuctioning. If you do a bunch of liposuctioning, then you swing and gain a bunch of weight, you're going to take on this funny look.
Any body contouring maintenance is huge. A little weight loss post-body contouring is great. A lot of weight loss can lead to excess skin. So you got to be careful of that. And then we've already covered and talked about this, but weight gain can be hugely detrimental.
Other thing I think in 26 will be bigger is that is regenerative tools and technology in our space. There's things that have come that are gaining a lot of traction. And when we say regenerative tools, what are we talking about?
You touched on one of these biostimulators and ways to kind of promote internal cell growth. And so it's like, hey, are there things we can put in our hair, to regenerate hair growth? Right. Are there topical things we can put on our skin to help maintain the collagen and elastin? And there are new stuff coming out all the time.
And you're talking about, exosomes, growth factors, And some of these things are highly regulated. Some of these things are not regulated. So there's a lot of noise in figuring out what's safe, what's not, what is actual legit. Some of these things are very costly. Some of these things might be being injected in places, and some are saying it's safe. Some are saying it's not safe because it's not on FDA on label. So it's nice. And I think when there's a lot of stuff and there's a lot of opinions, that means something exciting is going on. So I think that regenerative space is really interesting. We've been using like microcoring, aka Elocore, a fair amount on face. We've used it a lot on the body. We're going to continue to use that. I think that technology is going to improve further to where you can get laxity treatment without having big scars. In regard to approaching breast and getting breast enhancement, what's going to happen this year in your opinion?
I think the trend towards smaller implants is going to continue.
Yep.
So I really do think we're going to stay on that trend. But I also think we're going to be more in this minimally enhancement kind of breast preservation techniques, right? Where patients are going to get small incisions and try to get the procedure done under local anesthesia without having to go under general anesthesia and not disrupting kind of the breast architecture, right? Keeping the core footprint of the breast the way it is.
Right.
I think that's going to be in the forefront of what's happening in breast surgery.
Yeah, and I think that is like opening people's eyes to what they can get. Meaning, you can do a procedure, you can use a very small device, you can potentially not disrupt tissues as much using preservation techniques, which we all know as plastic surgeons how to do, but we're building on it. We're using techniques from old and techniques from new and combining it now. But but doing a procedure on someone where you're doing a little less anesthesia, but also like they can just recover quicker. And so like the mom or the working woman who's like, I don't have time for this crap, all of a sudden kind of does have time for this, and they can have a breast footprint and volume to where she doesn't have to wear a bunch of padding, or when she was wearing a bathing suit, it's not waterlogged. So I think that small volume enhancement is game changing.
Patients go to dinner that night and do normal activities the next day after a technique like this.
Yes.
Because I think the ability to do it is because the devices are better.
Yeah.
Right. It's like as the devices advance, we can actually do these techniques without any trouble.
Yeah. And I would even go even further and say, as we understand the properties of the device and how the body behaves with it, we have to adapt the technique to use that device in the most effective way. And that's what we've done with this, that it actually works in this situation, where if you did this with historical, techniques and devices, it wouldn't work and you'd actually get issues. This one, it actually works. So it's kind of funny how as you look forward into the future about what we're doing, you have to look into the past. And a lot of times everything we're doing now is because of what happened in the past, and we're like bringing something old into something new, adding something kind of new to it, going back to what we were doing back then. It's kind of a crazy phenomena. How about in regard to fat, off-the-shelf fat? What place is that going to have in 26?
We started using it towards the tail end of 25.
Which product is that one?
I love Alaclay. I think it's my go-to off-the-shelf fat product. It's robust. It actually acts like real fat, which is amazing. You can actually put high volumes into area where before some of the off-the-shelf fat was really low volumes. Now we actually have a product that has high volume. Yeah. I do a lot of breast surgery. I think we all know that. I used it a lot in patients that had rippling and wrinkling with some of these old devices, and you can camouflage that with this fat, which is amazing.
And people need to know, like, listen, at the end of the day, to be crystal clear, that fat is allograft fat. So that is fat that it's taken from other humans, and then it's purified, and it has the immunogenic materials removed from it. But it is pretty remarkable. I'll have to say that I've used it on patients. We've talked about take rate before, seems to be pretty high. And it's a procedure you can just do. So they don't have to have liposuction for it. And we've used it in high volume for buttock enhancement, for hip dip enhancement, for breast enhancement. I'd say the biggest issue with it is it's expensive. So we're going to tell you all that it's very expensive, but it is valuable and it works, and it is something we've never ever had.
You can do it under local anesthesia too.
Yeah.
You don't even have to be put to sleep to have fat grafting done.
Yeah. So I think it's really remarkable. And what we can do is, this is another time where you can combine that on its own, or that with surgical interventions, and get outcomes we weren't able to get before. And I think that is very exciting.
I think that's the trend in breast surgery. I still think we're going to still see young patients getting facelifts. I think that trend is still here to stay.
Yeah. From a standpoint of how young would a facelift be, the youngest, and I can tell you my experience. I've done facelifts as people in their kind of low 30s, okay? And as old as 90s, and they've had their third or fourth facelift. But here's the reason. Now, it's not just because I'm doing someone on a facelift on someone who doesn't need it. That person was a massive weight loss patient who had tremendous neck laxity, neck skin hanging down. And like that patient needed a reconciliation with how she looked, with how she felt. And she's been very happy. And so I think that, and that's the dramatic change patient. But truth is, most of our patients are smart, high functioning, refined people. Some of them might have, a role where they're a manager of an organization, or they're an exec, or they're a mom, or whatever it is. People want to look like they look, and they don't want to look like somebody else. They don't want to look in the mirror when they see that they're starting to look like somebody else, so they want to take action. And so it's a very effective way to combat that.
A few years ago, everybody's like, oh, what non-invasive things can we do to minimize the need to do a facelift? Yeah. And they were like, screw that. Too expensive. I have to go to see the doctor every month or every couple months to do this. I don't know if I see results or not. I'm getting sold on these really expensive devices that may or may not work. Right. Let's go back to the gold standard, tried and true. Let's do the traditional surgery route. And it's worked.
It's worked. And I would tell you the only other piece, though, that at least we're doing is that we are combining that with this concept of preservation after restoration. So using the technology that we have, using the smaller little things afterwards where we can layer on after a facelift, that's the great thing, that you can really prolong that result so that you're not just like re-upping your facelift every few years. Now, you will have to have secondary facelifts, and there's nothing wrong with that, and it can be done in a beautiful way. It can be very elegant, non-surgical looking. But if you can kind of, get a little bit of duration out of it, like a laser resurfacing, like maybe microcoring, like, some neuromodulator. There's little things you can do.
You brought up that L-core. I mean, how often are you using L-core with your traditional facelift today?
Oh, very common. Sometimes we're combining it directly together. Sometimes a patient wants to essentially kick the can for a couple months or a year, and we'll get them a little bit of an improvement. And then others, we're supercharging what we've already done. And I think it's just part of our armamentarium, or part of our kind of aesthetic ladder that we always, in plastic surgery, we're all trained to have a reconstructive ladder, like 20 different things you can do to handle any level of complexity. It's the same thing with the aesthetic patient. And I think it's just part of that,
The other thing I'm seeing, and I'd love to hear your take on it, is people want to feel as good as they look, right? They're getting this plastic surgery done. They look great. Now they're like, Doc, I want to feel as good. So that this movement towards overall wellness combined with kind of aesthetic surgery is on the rise.
Yeah, it's definitely on a rise. And I would tell you they live hand in hand together. And I think we'll continue to see that. And I think for us, I think that's when you hit the magic sweet spot where you obviously, help someone with a functional or visible issue that they have. But when that is tied together with their generalized, well-being and lifestyle, it's game changing. I mean, it literally is life changing. So I think that is absolutely true. What about this concept of rib remodeling?
Yeah, I think it's here to stay, but it's only going to be for the certain subset of patients. Right. I don't think you're going to see this huge influx of patients. Okay.
What about
flying in to have that done? I don't know if you disagree with that or not, but I think it's only for the small subset of patients.
I think again, it's part of that the ladder approach, when you can at least, every single surgeon should be able to point out, say that if they had that issue and they could benefit, we should be able to call and say, you would benefit from this, and here's why. And then to use it, not just be like, I do it on everybody.
I think we're going to see a huge influx of rhinoplasties. I see more and more patients. I think it was one of those, it's always been like a top 5 procedure in plastic surgery, but I think it's going to dip a little higher. I think more and more patients, they see how easy it is. I think, one, how easy it is. 2, they're seeing the results on social media, right? Which I think social media is going to be a huge, boom or continue to boom for patients wanting those procedures, because you can see the results like that.
So I think, the question is kind of, what about these smaller procedures? These, like, people will call them tweaks or tweakments. And those are some of those ideas, are things like, micro procedure, like central lip lift, maybe upper eyelid bleph, little submental lipo.
I think it goes back to the fact that patients want minimal downtime, right? They want to get back to, think about you. If you wanted something done, you want to feel and look better, but you're like, I don't want to take time off work. I think this is a great subset for patients. Like, hey, I can get this done, go back to work within a few days or a week at worst, or I can, hide out at home and work from home.
Yeah.
Heck yeah, they're going to do it all day long. So I think, yes, I do see that we're going to see a rise of these.
Yeah. And I think that we're going to see a rise using, there's, AI is everywhere, and we're going to see the use of AI for people to kind of help represent kind of what aesthetic endpoint they're trying to achieve. I think that's going to be more where you're going to have people coming into your office showing them, here's how I think it should look. That's good and bad. I think it's going to potentially set some precedent of some unrealistic expectations, but it also will help ground us as providers as to what a patient's goals are. So I think we need to be mindful of that. Our hope for 2026 is that the patient will become smarter, will become more educated by utilizing avenues like this podcast, where we can help empower patients to really do their diligence, to really understand what's possible and help them achieve what they're actually trying to achieve, not what a social, on trend look for a lip is. Ideally we want to help people, refine what they already have. And if there's a real functional issue, address that functional issue, and then them have something that they love that's timeless. I think it's a big thing that maybe a lot of our partners or colleagues, not partners here, but our colleagues across the country or across the world, may forget. You just want to do surgery. Somebody wants a big 1,500 cc fat grafting to each butt, and they just do it. Versus like, hey, let's talk about this. This is what it's going to be like.
What do you think about high def lipo or high def tummy tucks? Here to stay, or on trend for last year?
I think a softer version will be here to stay. I think some of the high def lipo, some of the high def tummies, like I think some of them look really good. But some of them, in my opinion, don't look natural. They don't look soft. They look harsh. And I'm gonna tell you, I offer all those techniques, but a lot of my patients do not necessarily want that. They want to just look elegant and natural. So I think we should take aspects of all of them. I'm curious about your thoughts on it, because you actually might think that differently than me.
No, I agree with you. I think it was a trend the last few years, and I think we're going to see a decline of that and more kind of softer appearance.
Right. More kind of essentially outlining normal native anatomy, but maybe not to that harshness level. But like some of our colleagues are just remarkable at doing it, and I'm like always impressed and amazed by it. But I will say, man, there's only so much oil or alcohol you can put on your before after photos. Like, come on. Like, I mean, you show this like picture of someone kind of looking way fattier than they were afterwards on table, obviously, and then they're just greased up like crazy, and the lighting is all like, this is all smoke and mirrors. So like we want our patients and our people who are watching, like, please don't let that unamor you only. Like we kind of refuse to do the whole oiled up body and like the alcohol thing, or like window pane, the little tiny area to make something look so remarkable and different, when in truth it may be a misrepresentation. So I think patients should do their homework when they're like figuring out what they're going to do.
What about buttock augmentation?
Oh, buttock augmentation, like implants?
No, I mean, not only implants, but fat grafting.
Yeah, this is a big deal. And like, this is the thing this is a huge issue. It's an epidemic, the no acetol syndrome. I suffer from that, but I try to work out and it doesn't change.
I don't have that problem.
But the truth is no, because especially with massive weight loss, with all these GLP-1s, a lot of times when women have kids and the body changes, they can have kind of buttock flattening too. And so there's lots of things that can be done. I think we're going to see more buttock lifting. Buttock lifting is actual skin excision, not Brazilian butt lift, but that combined with potentially some fat grafting. The other things are going to be, sometimes people talk about like doing buttock lifting with auto-augs, where you use your own tissue to kind of fill it in. But a lot of times these massive weight loss patients don't have that tissue. And we do have some other techniques that we've been doing at HKB for, I don't know how long. Joe Hunstead kind of learned from Rodriguez, and in South America, buttock implants. What are the issues with buttock implants?
I don't think they're as stable as, other body part implants, like, most typically breast implants. So I'm not a big fan long-term because of the complications that can arise. I think, I think they're great in a certain subset of the population. But I think they're fraught with complications long-term. So I tend to encourage patients not to do it.
Yeah. And, we still do, we will do a handful every year. And I'm not gonna lie, some of my patients are really happy with it. Historically we'll do the intramuscular dissection, which can be a kind of a very painful dissection, a lot of recovery. And I've done more and more actual subfascial dissections, and they've been pretty happy. The issues that, like you said, visibility, and you can palpate the implants because they're very hard. So I think the implants that are in the U.S. right now are very dated. The ones that are outside the U.S. are pretty nice. One of the implant companies is working on, they've already had it where they do a minimal invasive approach, and it's because the implant itself can really work well. And so you can combine a really small implant that's placed kind of with minimal level of invasiveness, and then potentially combine with a little bit of fat, that's great because you get this idea of core projection, and then you can get, kind of essentially soften it with fat. I think that is going to have some real legs, I think, in the U.S. I think it could really disrupt the market.
But traditional implants in the U.S. today, they're harsh. Patients sit on, their butt all the time.
Yeah.
They're using their butt to walk, to do activities. It doesn't stay put.
Yeah.
I'm not a big fan long term.
One other thing I would say that I think is going to be trending, because it seems to have started to trend higher, at least in my practice of recent. It's always been there, but it's just eking up quicker. We talked about kind of under the chin lipo, but under the chin lipo with a small chin implant, super powerful. And it is game changing for the jawline, looks very elegant. So I think I do forecast that.
And
becoming way
oftentimes
more
with
popular.
buccal fat removal, right? They're trifecta.
For sure.
I mean, I think it's common practice in at HKB to combine procedures all the time. I think safety is by far the most paramount in deciding when to combine procedures, when not to. And it's all about timing, but we do it routinely. And I think there's certain procedures that should be done together, right? Because they complement one another. If you're doing the tummy, the anterior part of the belly, you definitely want to look at the lower back as well to make sure, because it complements everything. And oftentimes when patients come in for their tummy, they want to address their breasts. And so typically we do those together. Now, it is also not uncommon for us to do a big facial procedure with a body procedure in our practice. Because again, we utilize both our expert surgeons. We have a facial plastic surgeon on staff. We have all our surgeons actually do a ton of facelifts. So we can combine both approaches at the same time and do it safely.
Yeah, one of the big things, like I'm a big fan of combination surgeries when done in a safe and effective fashion, obviously. But the reason why is, we don't look at patients like when a patient comes and say, I'm worried about my tummy, and like you look just at the tummy through, you're not looking at it with binoculars. They might be, but then you have to realize, like, hey, you got your flanks, you got your posterior torso. We need to take the air of that whole unit. And then a lot of times when we are like approaching a mom who's had kids and they have issues with their breast, abdomen, we're doing kind of total truncal rejuvenation. So it's like we want to restore things back to their prime. And so by taking care of breast, abdomen, and posterior trunk and potentially buttock area, we get that done for them. But splitting up procedures, totally reasonable, very safe. And if that's what a patient wants, and if that's the better solution, then I think they should go down that route. But a lot of times patients have only like one time of recovery, and having another surgical procedure in the future and another recovery and potentially anesthesia risk at that time is something they don't want to tackle. And when you think about the face, for example, a lot of times patients will come in, they'll come and see, and they're like, hey, I want to just do my eyes. And they want to do upper lids, lower lids. And then so I explain to them, hey, listen, again, we're looking through those binoculars, but what about all this? And the reason why we say it is like sometimes if you do a remarkable intervention, you restore one area, it looks so good, it's discordant with the areas that maybe don't. And so that's times when you need to consider panfacial rejuvenation, like a lower face and neck lift, and or central lip lift, and or CO2 laser resurfacing, and or rhinoplasty, and or otoplasty, and or brow lifting. I say all those things. That doesn't mean everybody gets all those things, but each patient will probably get a smattering of whatever respective things that they could benefit from. And so combination surgery it's weird because like it's almost like we're itemizing stuff, but really what we want to do is we're trying to like rejuvenate a patient's areas of concern and make sure they get a good outcome. So we're basically outlining a plan that's going to achieve that versus like, we're going to do 1, 2, 3, 4, 5. It's really, we're doing 1. This is what we're going to do.
Yeah, it's super important to listen to what the patient wants, but it's also our obligation. And I've used this word a lot today, but in regards to us, I think we're obligated to tell patients all the things that complement that area that they're wanting to change or address, right? And so by us informing them and educating them as to what can happen, enlightens them as to, oh, well, I didn't realize that. To your point earlier, you were like, what if you do liposuction here? Do you need a chin implant? They probably didn't even think about it until you brought it up. And then once you bring it up, they're like, oh yeah, I actually do want that because this is the look that I'm going for. So again, it's all about tailoring the results to what the patient's looking for.
Yeah. And I would say the other thing too is, and a lot of our injectors and our aesthetic providers are really good at this. When a patient comes in and they're first being seen, our approach and their approach is not like, I want something in my cheeks. It's a full facial assessment, talking to the patient, what are the concerns, what are they trying to achieve, and then creating a roadmap for that. It's not a one and done thing. It's a progressive intervention, progressive series of visits, treatments to help people achieve their best and then to maintain it. So you don't have to go in there and be like, I need 20 syringes of X, Y, and Z. That's not the case at all. It needs to be a progressive a purposeful thing where you can gradually get the result that you want. Obviously, sometimes you need to be boom and get something done big and transformative acutely, but actually it doesn't necessarily have to be that harsh. And I think that's a big thing that we pride ourselves on. And also it's a big reason why people stay with us.
But I think you hit the nail on the head in regards to trends for this coming year and beyond is actually giving that approach to the patient. Where traditionally patients would come in, they want their surgical procedure done. You do it, do a couple follow-ups and they're gone.
Mhm.
And then you wait for them to come back years later if they want something else. Now it's like, all right, what can we do to maintain not only these results, but your overall goals on everything else
Right.
that's happening? And so that I think that is the huge trend moving forward in our space.
In the past year, 2 years, dermal fillers are taking a big hit. They've kind of really reduced down. We're tight with all of our industry partners. We know that they've really receded from the standpoint of use, and now they're coming back up. I think what people need to remember is dermal fillers are here to stay. They're made out of constructs that are synthetic analogs of what we already have in our body. Hyaluronic acid, calcium hydroxyapatite is not in our body, but that's more of a biostimulator filler. I think all these are going to stay. They work really well. And I think we're gonna do better at how we use them, right?
I think, the reason why they fell out of vogue is, you saw all these pictures online and on social media and in articles, celebrities and individuals getting way too much,
Yeah.
right? It was just way overdone. And the look was horrible if it was way overdone. Because again, you would go into these med spas or these local injectors and they just wanted to fill you up as much as possible. For whatever reason, right? Maybe it's they thought that was the best approach. But what ended up happening is it gave individuals not the best ultimate outcome, right? And
Right.
so now as we get, more in favor of, hey, we need to use them because I think they work and they work really well because they've been around for a long time. But let's just use them in the right amount. Let's not overdo it. Let's
Right.
do it in the right areas with the right approach. And I think that's a way better long-term viewpoint on how to use these dermal fillers than what was happening years ago.
Yeah, and I think a multimodal approach. I think utilizing dermal fillers alongside biostimulators, alongside different energy-based technology like for resurfacing and/or other regenerative tools like PRF, PRP, and microneedling. All these things, these tools really do work, and I think sometimes a little can go a long way. And I think that we've all kind of realized that, and now we're going to kind of continue to utilize those things as we go forward. Because a lot of times our people, even our big facial intervention patients, sometimes they need a little bit of biostimulator action. They need a little filler after a facelifting type of procedure, just to kind of maintain what happens, maintain the pop. And I think that's just a nice way to do it. And I think it's not, these things are not going to just go away. There are a lot of products on the markets. If you look at our counterparts outside the U.S., you go to Europe and other places, there's hundreds of different kind of fillers. So I think they're going to continue to bring in new modalities into the U.S. There's also some higher volume fillers that you can use in off-label fashions, like for buttock and hip dips in different areas. So there's a lot coming in that area, and there's a lot of new biostimulator products that are coming too, which I think are going to be interesting. There's some biostimulator hyaluronic acid products coming, which I think are going to be very interesting for our patients, and that we will need to all be very aware of and use for them to get great results.
Yeah, my only potential caution to any patients is to use the permanent fillers.
Mhm.
If you don't know the end outcome of what it's going to look like, or if you're going to even like it to begin with,
Yeah.
I probably wouldn't use a permanent filler.
Yeah.
I would kind of reserve that for a secondary, tertiary
Yep.
procedure.
And I think go to an expert for that. Like one of our injectors is a huge volume user of a kind of semi-permanent filler called Bellafill, and she gets amazing results. And I've seen results. I'm like, wow, this is killer. But they are typically not naive patients.
Not the first time.
They're actually the patients who have had filler fatigue or chew through other filler. So there are reasons for that. There are a lot of other things going on in the neuromodulator side. A lot of other neuromodulators, aka wrinkle reducing treatments that are now available for patients, and I think that's exciting.
Early onset,
Yeah.
Early action type neurotoxins, they work really well.
And maybe work better for the people who burn through neuromodulators. So I think there's going to be some more choices on that, and I think that's going to continue to flourish as well. And these neuromodulators, wrinkle reducers, are used in all kinds of different fashions too, for obviously things like headache reduction. They can also be used for things like scar mitigation. So actually using for scar treatment. So there's lots of interesting things happening in that space. All right, my friends, hopefully you enjoyed this episode. If there's anything you want to talk about aesthetic surgery, please send us a DM on Instagram or put us a comment in on YouTube. Thank you.
Thank you for listening to HKB Uncut. If you enjoyed this episode, please subscribe to us on Apple, Spotify, or YouTube.
To book a surgery consultation or med spa appointment with our team, visit our website at hkbsurgery.com or head to the links in our show notes.